very much. I'm very glad, I'm very honored, and I'm even moved to be invited here to celebrate the 100th anniversary of Mogens Schou, who was definitely the biggest lithium researchers of the 20th century. And I was asked to, it was not easy task to put the Mogens Schou achievements in the context of the history of lithium. And as my previous speaker told it, that lithium is one of the first three elements together with helium and hydrogen to be synthesized in the Big Bang. So lithium is accompanying us from the beginning of the world. But now, as far as history of lithium as an element is concerned, I must mention some predecessors of the achievement of Mogens Schou, and I will make this Swedish or Scandinavian predecessors and also some Australian predecessors. It is very appropriate as our previous speaker can be named a kind of successor of Mogens Schou achievements in Australia now. But now about the discovery of lithium as a chemical element, and it was done in the laboratory of great Swedish chemist Janusz Jacob Berzelius, and in his paper in 1917 he kind of notified about this discovery, which was made by August Arvarsson, assistant of Berzelius. As you see in this paper, he praised Arvarsson. It's very young. He was 25 years old when he made this discovery, so it was very young. He was working in my laboratory for a year, found during an analysis of petalite from Utos iron mine an alkaline component, and we named it lithium, and so. And next year, it was just 200 years ago, this young chemist Arvarsson, in his paper published in Schwager's Journal for Chemie and Physik, is just described his discovery. Untersuchungen einiger bei der Eisengrube von Uto vorkommenen Fossilien und von der einen da gefundenen neuen feuerfesten Alkali. So these were Swedish or Scandinavian predecessors of Mogens Schou, which was farther, and it just started the history of lithium as a chemical element just 200 years ago. And now we have very important Danish connection. So 19th century Danish predecessor of Mogens Schou. And of course the most important is Carl Georg Lange, who was regarded as a probably most distinguished 19th century scientist, and he made a great achievements in neurology with studying of acute bulbar palsy, spinal cord inflammation, and he is also the author of the first neurophysiological theory of emotion, called as James Lange theory of emotion, as a perception of emotional states, as an experience of peripheral somatic changes in response to emotional stimuli, together with William James. However, William James, who was a philosopher, did not propose any brain structure for this emotional feelings, and Carl Lange did it as a vasomotor center. And out of this, also Lange can be named a precursor of lithium therapy of mood disorders. His German translation of the book he published in Danish 10 years before. It was in 1886, was named in German Periodische Depressionszustände und ihre Pathogenesis auf dem Boden der Harnsäurendiathese. So the illness was caused by an excess of uric acid in the nervous system, just as good of the brain. So the hypothesis, pathogenetic hypothesis, was called uric acid diathesis, and before the good conditions were previously treated with lithium are the most solubly, because lithium urate was most soluble salt. So that was a rationale for Lange, also for lithium treatment, similarly as in good diseases, which was probably introduced by British doctor Archibald Garrod. And he was treated many patients, and as some estimate, it was as many as 200 patients to 2,000 patients in his ambulatory practice. And he used lithium carbonate as a powder, and the doses similar as contemporary. And what was important, that the lithium therapy was administered on a long-term basis as a prophylaxis of recurrences of periodic depression. And Lange mentions that such treatment resulted in a disappearance or decrease of depressive episode with a significant prolongation of remission, although in most cases the illness was not fully cured. And also his brother, Frederick Lange, who was a director of one of psychiatric hospital in Denmark, but he used lithium in the treatment of hospitalized psychiatric patients, but not many data on the effect of such treatment were received. So the Lange brothers, or mainly Carl, can be named founding fathers of lithium therapy in psychiatry. So far about Denmark predecessor, the Danish predecessor, and now we go to another end of the world, to Australia. And of course, the first such man is John K, who was a Japanese prisoner of war in Changi prison, and then he had some thoughts about the psychiatric illnesses, and after World War II he found employment in the mental hospital in Melbourne, used an abandoned kitchen. He did very important research on the biological causes of mental disorders, working on guinea pigs. So what he did, he first observed that the urine of manic patients is particularly toxic to guinea pigs, so he speculated perhaps there was something excessive of uric acid. And he gave as lithium urate to guinea pigs in form of lithium urate, and he observed reduction of toxicity in animals and also states of, he called the lethargic state. However, the same effect was obtained not with lithium urate, but after lithium carbonate. And then he made a very crucial thing, because he ingests lithium carbonate itself and then find his to be safe. And after this, he gave lithium to 10 manic patients, obtaining remarkable therapeutic results. You probably may observe that this introduction of lithium in terms of today's standard would be called as a violation of all good clinical practice, of course. However, it started this way, and this publication in Medical Journal of Australia in 1949 with these spectacular results in manic patients can be really regarded as a beginning of modern clinical psychopharmacology, because this publication by 3 years preceded the publication of French authors on first antipsychotic Delay and Deniker on the first antipsychotic chlorpromazine. So, very nice results with lithium, but also Kate made some speculation. And he speculated that the effect on patient with pure psychotic excitement, that is true manic attacks, is so specific that it inevitably leads to speculation on a possible etiological significance of a deficiency in the body of lithium ion in the genesis of this disorder. Very nice speculation, because it seems that some of this speculation can be corroborated nowadays. So, is trace lithium important for mental health? There are at least 2 areas that we found that it may be important. One is suicidality, which is already was mentioned, and the second is dementia. So, as far as the correlation between lithium and drinking water and suicidality, it was confirmed, and several studies in Japan, in Austria, in Texas, and in Greece. And another area is trace lithium important for mental health about dementia. So Brazilian authors found that microdose of lithium, they may preventing a cognitive loss in Alzheimer's disease, and there are two studies. One is very important Danish contribution showing the inverse correlation between lithium in drinking water and Alzheimer's and vascular dementia, and also Texas then found Fajardo the inverse correlation between lithium in drinking water and changes in Alzheimer's disease mortality. So these two areas may be something in favor of Cage's speculations. Okay, but apart from Cage, there are some other lithium predecessor of Mogens Schou. Two these gentlemen, one is Charles Haag-Nock, who is a psychiatrist, and Edward Trautner. He is of German origin, but working in Australia as physiologist, and they published in 1951 a seminal paper. It was Noack and Trautner, the lithium treatment of maniacal psychosis, when they described the therapeutic effect of lithium in many in 100 patients. So it was very important paper, and so these two gentlemen can be also named predecessors of Schou. And one other Australian predecessor is Samuel Gershon. He may be partly my countryman because he was born in Poland, in Łódź, but then he graduated from medical faculty in Sydney, participated in Melbourne in lithium research and collaboration with Edward Trautner. He moved to the United States for nearly 20 years, was a director of psychopharmacology at New York University. He was a great promoter of lithium introduction in the USA. He was something like prime mover of the International Society of Bipolar Disorder, and he was the first editor-in-chief of the journal Bipolar Disorder, and Jean is now the current chief of this journal. So, as you recall, both Lange and Kate made some connection between introduction of lithium to the treatment of bipolar illness with some uric acid diathesis. So what happened to this to this hypothesis of uric acid diathesis in mood disorders. In 20th century, Emil Kraepelin, who probably know the Lange studies, he dismissed the concept of periodical depression. It didn't fit into his concept of manic depression Irvine, and also dismissed the pathogenic concept of uric acid diathesis. However, he used lithium in some patients with epilepsy to treat them. But it should be noted that another German psychiatrist following Kraepelin, three psychiatrists named Karl Wernicke, Karl Kleist, and Karl Leonhardt, they coined the concept of monopolar depression as in contrast to bipolar disorders. And now we have another name, Hans Jakob Schou. It seems familiar because he was the father of Mogens. He was the director of psychiatric institutions since 1922, and he, by some people, is regarded as a founder of modern Danish psychiatry. And in some of his papers, he praised the Lange's description of periodical depression. He also speculated about the lack of manic episodes in Lange's description. His speculation was that in Lange only treated ambulatory patients, and ambulatory patients are never come to psychiatry on account of their mania. Never, or hypomania. They come only for depression. So probably it was one of the reason for lack of manic episode in Karl's description. However, he refuted the concept of uric acid diathesis and also the use of lithium. Mogens started his work on lithium just in the work of his father's death in 1952. And the final so-called coup de grace of this uric acid was given by the German psychiatrist Werner Feldberg in the article who was published on the 100th anniversary of Lange's treatise on this periodic depression, and he argued that the reasons for the oblivion of introducing lithium was that the idea of uric acid was false, was refuted by both psychiatrists and so, and he also speculated, this Werner Feldberg, how a false theory could sometimes result in a spectacular clinical achievement. And he called this uric acid diathesis in German ein genialen Irrtum, or ingenious misconception. However, when we go to the 21st century, so it was found that uric acid, the end product of the purine metabolism, and some purines, mostly adenosine, play a role in the regulation of mood and activity. Higher prevalence of good was found in bipolar disorder, increased uric acid was found in mania, and it was probably online in bipolar disorder. The publication of psychiatrists from Madeira that serum uric acid can be a predictor of bipolarity in individuals with major depressive episode. Another part of this uric acid diathesis is connected with receptors, purinergic receptors, P1, which was adenosine, and P2 receptors. And as you see, the activation of adenosine receptors has antidepressant effect, may reduce concentration of uric acid, and increase level of adenosine were caused by several procedures, several antidepressant procedures, lithium antidepressant, ECT, sleep deprivation. And also there were some association between P2 receptors and bipolar illness. So, and here comes Mogens Schou. Mogens was born in Copenhagen. Father was psychiatrist, director of psychiatric institution. Brother was manic depressive illness. He graduated in medicine at Copenhagen University in 1944 and received training in clinical psychiatry, experimental biology and neurochemistry, and started lithium studies as a psychiatrist at the Aarhus University Psychiatric Institute in 1952. So, Mogens Schou could be named primus inter pares among lithium researchers because he was the first who performed pivotal experimental and clinical research on lithium. First, it was the placebo-controlled trial, which was, as it was published in 1954, a spectacular deed to make the placebo-controlled trials of lithium efficacy in 39 manic patients. And he did it, he was kind of inspired by Professor Strömgren, who also kind of was fascinated with lithium and told Mogens to go into it. So it was a spectacular improvement in 12, improvement in 15, and the lag effect in 3 of them. And also, it was not the first, but also in this paper, a concomitant determination of lithium in blood and cerebrospinal fluid was made, and was shown what was the reason for the next establishing the recommendation for this lithium concentration. So it was 1954. 3 years later, in Pharmacological Review, Mogens did the complete presentation of updated knowledge on the biology and pharmacology on lithium ion. It was 1957. Then we have the beginning of 60s, when the 2 studies were published, one coming from England, Jeffrey Hartigan, and the second 1 year later from Denmark, from Paul Christian Bastrup, suggesting that long-term lithium treatment can exert a prophylactic effect, preventing recurrence of either manic or depressive episodes. And this Paul Christian Bastrup, together with Mogens Schou, gave the first evidence of lithium prophylactic activity on a large group of patients. It was the patient from Glostrup Hospital, 88 patients with unipolar and bipolar affective disorder. The average duration of disordered mood within a year. Before lithium, it was 13 weeks, and on lithium it was reduced to 2 weeks. It was 67. And then, very important year, 1968. The first evidence of lithium-induced goiter. So first evidence that lithium may act on the thyroid function. The goiter was found in 20 of, all this time, 330 patients treated with lithium for 5 months or 2 years, and there was also suggestion of thyroxine treatment. Another very important study was first characterization of lithium poisoning in the terms of description of prodrome, clinical picture, outcomes, and subjected management. Here is also the guy who was very instrumental for the lithium for the estimation of lithium concentration. It was MD Sen as a second author of this. And the third very important study was a study which was done with Klaus Thomsen. It was the first study of the mechanism of renal lithium reabsorption. It was found that lithium is reabsorbed mainly in proximal tubule, and it is very jointly done it with sodium reabsorption. And this discovery gave the first plausible explanation of lithium toxicity, which was sometimes fatal in subjects receiving lithium as a salt substitute. Such procedure was done in probably United States and also Australia at the turn of 40 and 50. And then there were several deaths of this, and now it was found that lithium, and when there is low salt yield, so the lithium reabsorption at proximal tubule is very, very high, so it's very high concentration of lithium, and it may lead to death. Okay, and the same year, there was a great backlash of lithium, which was done by the British people working in Maudsley and Institute of Psychiatry, Barry Blackwell and Michael Shepard. It was very strong backlash on prophylactic lithium, and named prophylactic lithium another therapeutic myth. And now, 50 years after this, Barry Blackwell was commenting under the title of Lithium Controversy, a historical autopsy. This was a discussion on this topic which was done within the international network of the history of neuropsychopharmacology, which is the discussion forum mostly governed by Thomas Bahn. And I was also a discussant, and then in December 14, 2017, Barry Blackwell replied to my comment. And what he said, once again, I'm grateful to Janusz Rybakowski for sharing his knowledge of lithium. And then it is the statement of Barry Blackwell. He was just putting this therapeutic myth. What emerged, it is uncontestable conclusion that lithium remained the best first choice for mood stabilization and bipolar disorder, and still shows evidence of benefits for other novel indications. So the Barry Blackwell is a real converter in favor of lithium. Okay, and here this next year, these three guys which were instrumental to lithium. And 1973, the group of Mogens Schou made the first suggestion of using propranolol in lithium-induced tremor, which now is a common practice, of course. And also, it was in 1979, there was a first report of lithium effect of pregnancy. And it was obtained on 118 children born to mothers given lithium during the first trimester of pregnancy. And Schou was one of the initiators to do so-called the register of lithium babies. And now, after 40 years or so, we have a publication which was in Lancet Psychiatry, and the first author is coming from Aarhus, so also is Denmark. So it was a study of a great number of lithium pregnancies. So the conclusion, the lithium is not associated with any pregnancy complication of delivery outcome. There is some increased risk for prenatal readmission, and during the first trimester there is increased risk for some major malformation, but not for cardiac, which was suggested before. Another thing is that Mogens Schou was very keen about using lithium as a prophylactic agent in unipolar affective illness, and in this paper in 1979 he made the first strong suggestion of using lithium for prophylaxis of unipolar affective illness, and he was pursuing the concept of a so-called hidden bipolars who may be good responders in such a prophylactic procedure. And it should be mentioned that a proposal of such controlled trial he made during the ICSLI meeting in Poznań in 2005. How about 40 years after? The the paper who was published in Lancet Psychiatry by Scandinavian Finnish authors, Tihonen. It was a cohort study and great number of patients. However, the conclusion is that lithium, especially without concomitant antidepressant use, is a pharmacological treatment associated with the lowest risk of hospital readmission for mental illness in patients with severe unipolar depression. As artistic profession is definitely overrepresented during people with manic depressive illness or bipolar illness. So Mogens was also interested in this, and he did the first study on the effect of lithium prophylaxis on artistic productivity. It was published in 1979. And what he found, that from 24 artists treated with lithium due to bipolar disorder, 12 reported an increase, 6 a slight decrease, and 6 noted no change at all. And Mogens was also very concerned about patients, about their families, and since 1980, successive guides for doctors, patients, and families appeared, and revised edition, first edition 1980, 83, 86, 88. They were called Lithium Treatment of Manic Depressive Illness, the Practical Guide, and sixth edition, which is here, was Lithium Treatment of Mood Disorders. And these three gentlemen were the founding fathers of the International Group for Studies of Lithium-Treated Patients. So Mogens Schou, Bruno Müller-Erlinghausen from Berlin, and Paul Groff from Canada, where he emigrated from Czechoslovakia. There. Okay, and as you see, in 1990s, there were three very seminal papers of ICSLI showing the anti-suicidal and beneficial effect on mortality in lithium patients. As you see, the three gentlemen here, Erlinghausen is, for this study, is most important, but also Paul Groff, Mogens Schou. They are authors of all these papers. And after the death of Mogens Schou, it was 2010. Also, there was ICSLI project. So there was from Canada, Czech, Germany, Austria, and Poland, where we found neuroprotective effect of lithium on hippocampal volumes in bipolar disorder, independent of long-term treatment response. So the group on lithium had bigger hippocampal volume than non-lithium group. There were both bipolar groups, regardless of the prophylactic efficacy. And the journal Lithium can also be mentioned, because although it was only in operation for 5 years, but it was really something as far as the lithium research and treatment is concerned. So it is the first number of this lithium, which was released in March 1990. And here we have the editorial board. Editor was Neil Johnson, Leicester, and out of associate editors there is Per Vestergaard. I saw Per here, so he must be here in the audience. Yes, yes, okay, okay. Per Vestergaard, and as editorial advisory board, there is of course Mogens Schou, and also my person, which is improperly spelled, but why I am I on the end. Okay. And Mogens Schou, of course. And this journal existed between 1990 and 1994, and Mogens Schou was the author or the first scientific paper in the journal, and this was about lithium and treatment-resistant depression by Mogens Schou. And what happened to this idea? As Jean mentioned already, lithium augmentation of antidepressant remains the best evidence pharmacological augmentation and treatment-resistant depression, and probably by some, by myself, probably by you, is regarded as a second main indication for lithium use in mood disorders. Right. And the many papers were done on this issue, and they were mostly authored by president of ICSLI, Michael Bauer from Dresden, and the recent review of this issue appeared in 2014. Okay, so as you see, Mogens and just was a recipient of the many awards from 1974. It was International Kitty Foundation, John K Memorial Award, Albert Raskell, International Society of Lithium Research, CNNP Pioneers in Psychopharmacology, and Lifetime NARSAD Achievement Award. And it should be also mentioned that Mogens was twice nominated to Nobel Prize for Medicine and Physiology. And since the inception of the International Society of Bipolar Disorder in 1999, Mogens was nominated his honorary president, and since 2001, the Mogens Schou Awards are awarded for prominent achievements in bipolar disorder in 3 categories. And now we have the picture of the ICSLI conference in Poznań in 2005, which was in 23-25, and Mogens, we remember him in good shape, together with Mary-Lou here, and as I mentioned, he also proposed this study on the lithium and unipolar depression, and as you see, 4 days after this conference, Mogens passed away. So there are probably some moving obituaries to Mogens Schou. First was Paul Grof, creator of this ICSLI. He was brilliant and creative throughout his life. However, what was the most striking and profound about him was his love and compassion for people. He was a kind and caring father, husband, doctor, colleague, and friend. And Sam Gershon remarked that although his contribution to the field will leave a permanent and lasting legacy, the loss of his humanity and personal commitment to science and patient care are irreplaceable. And here is my letter to Mogens I wrote in 1971. So it was a long time ago. And Mogens brought it to me, the copy of this, to the Poznan conference, and he gave me this. That it was such a long time ago. And so it was great honor for me this year in Mexico City that I was rewarded with the Research Award, Mogens Schou Research Award. Here is Tricia Sapes, the president of ICSLI. He is just presenting me the award. So here is this award for research. And so on this history of lithium, just I would like to point to these two Danes which left the most significant imprint on clinical use of lithium in mood disorders. First was Carl Lange, who introduced lithium for treatment of periodic depression on account of the theory of uric acid excess in the brain, which theory made some merit in 25th century. And of course, the person which he celebrating his 100th anniversary, Mogens Schou, which is the biggest contemporary researcher and promoter of lithium therapy and mood disorders. Thank you very much.